So hi, everyone. You know Phil by now if you've been in the previous session, and I'm going to give him a chance to introduce himself and then give his voice a rest because I know he's been speaking for a while. I'm Felicity. I'm a researcher, and one of my hats I wear is that I'm a visiting research fellow at the Institute of Commonwealth Studies at the School of Advanced Study, University of London. I'm the former executive director of the Kaleidoscope Trust. And I've been involved in LGBTI data collection for the better part of the last decade. And I've been having the wonderful opportunity to collaborate with Phil over the last several years.
Hey, all, sorry for the overlap to the last session. My name is Philip Crehan. I work at a company called Aolis Consulting. I've spent the better part of 15 or 16 years working on LGBTQ plus data collection, particularly in Latin America, the Caribbean, Southeast Europe, and throughout Asia. And then with those data, working with communities to develop programs of inclusion, of livelihoods, of socio-economic empowerment. For this paper and this research, I was also the principal investigator of research throughout 12 countries in the English-speaking Caribbean. Over to you, Felicity.
Thanks, Phil. So if you want to just go to our first slide there. Okay, brilliant. So just wanted to say two things here, which is that we're going to be giving an overview of our findings in a paper that was published last year in the Journal of Human Rights Practice. And we want to give great thanks to the third author of the paper, Micah Gridnovich, who is not with us today, but is a long-term collaborator and very engaged in the processes that we're going to be speaking about today. So please have a look at the article if you're interested. You can easily find it with our surnames, although I don't have the title in front of me, but it's very similar to the title of this presentation. Next slide, Phil. So I think, I'm assuming everybody in the room is very aware of the sort of process of developing the 2030 agenda from a general context. And I just want to kind of cast our minds back to 2015. In that 7-year period. And just to say a couple of notes is some of the language that we might use today, which has been developed 7 or 5 years ago, may have changed. So just be mindful that some of the language here might be seen as a little static. But I think the important point when we think about the 2015 context is that there were engagement of advocates representing LGBTI civil society organizations, and they engaged through a really deep consultative process to develop what was then called the post-2015 development agenda. Our co-author, Micah, is one of those advocates. And we know from that process that there were sort of understandings about the kinds of language that in a UN consensus document would and would not be agreed to. But so there was a push to ensure that there were sort of terms that were more inclusive. And one of those is that you'll see in a couple of key places in the document that terms such as other status were included, which were tried to be inclusive. If you started to look at factors based on what are known to be statuses of discrimination, this other status was meant to be inclusive of people excluded because of their sexual orientation, gender identity and expression, and sex characteristics. So it's, this was a nuanced process, and there was an understanding at the time that we weren't looking necessarily, those advocates weren't looking to get identity labels in there and community terms in there. But it was very well embraced at the time. The former Secretary General of the United Nations, Ban Ki-moon, and others at a high profile spoke about the fact that once we had the outcome document and we had an Agenda 2030, a set of sustainable development goals, that they would not be realized unless UN member states reached all people. And this is a specific quote Ban Ki-moon said, regardless of their sexual orientation, gender identity or expression, and sex characteristics. So there's 2 citations there to look that up. One's from a UN document and one's from a civil society-led research process. So that's our context that we were jumping off from at this time and taking forward since then. Next slide, Phil. Okay, so what do we know then, and what hasn't really changed that much in the preceding 7 years is that, and this quote is specifically from a Human Rights Council document written in 2019, so 4 years after the SDGs were being rolled out, that worldwide, particularly in low and middle income countries, so the countries of context for concerns about economic, social, and human development, data about lesbian, gay, bi, trans, and intersex people can be considered incomplete and fragmented or virtually non-existent and impossible to collect in most countries. It's a very damning assessment. And those of us who are very committed to increasing data have a really big challenge to work against in many settings. And given that challenge, there's been a number of movements to try to do something within that. And one of those is what we're going to be speaking about today, the LGBTI Inclusion Index, which is that initiative to overcome this paucity of data. It is a process that's been led by the United Nations Development Program, UNDP, which started in 2015. And it has been in many ways to offer a framework that UN member states could use to start to think about reporting on how they were being inclusive of LGBTI people as they made progress on the 2030 agenda. So we're going to be unpacking what that index looks like today. The next slide, Phil. Okay, so this infographic gives you a sense of when the index was developed, what are the sort of key areas of concern that those who compiled it were thinking about? What are the factors of exclusion that we most want to focus on? And so they've seen in sort of 5 main dimensions. And those dimensions are LGBTI people's ability to participate in civic and political life. And that is from issues that range from basic human rights engagement, but also political participation, including the ability of LGBTI organizations to be able to exercise their own freedom of association, assembly, and expression. Into the domain of education. There's been such a major push in development financing over several decades around ensuring that most young people can complete primary and secondary school and move into tertiary and higher education. But we've had very little focus on the factors of exclusion that affect LGBTI young people. In the dimension of health, we have very good health data, I would say, from many high-income countries on the health disparities that affect LGBTI people. What we haven't seen is a major effort to be inclusive of those concerns as we roll out development financing outside of very important interventions that have been made in the global response to HIV and AIDS. We have wider health disparities to be concerned about in low and middle income countries, increasingly concerns about mental health. Very much linked to those concerns about mental health are the very high rates of personal security and violence that people experience based on sexual orientation, gender identity, expression, gender nonconformity. And so there's been an excellent focus on funding efforts to overcome that by, including up to training police forces, et cetera, and sensitizing communities. And so that dimension is also identified as a priority area for data collection. And then finally, the fifth factor would be how LGBTI people can participate in livelihoods and the economy, measured as economic well-being. So that would take on a range of concerns, including non-discrimination in employment law, etc. And we'll be talking a bit at the granular level around data that Phil's going to share. So that's just a big picture of the 5 dimensions. And Phil's going to go on to the next slide. And I'm going to apologize in advance that this is very text heavy. Oh, no, not this one. So this slide gives you an outcome document that you can look up. The hyperlink is there. If you just Google a set of proposed indicators for the LGBTI Inclusion Index, you will come up with this document. This is co-produced by UNDP and the World Bank. It's the outcome of the final part of the consultation to frame the Inclusion Index. So the first part of the consultation in 2015 was to come up with the 5 priority dimensions I've just discussed. And the second part was to talk about how are we going to measure inclusion and exclusion. What kind of data could we be asking states to collect in order to report on their efforts to overcome these barriers? So this is the outcome document written by Professor Lee Badgett and Randy Sell. And that is the sort of go-to toolkit if you're thinking about how you might use this resource. What I'm going to do next, and this is where I am going to apologize again, is this is just a quick overview. And no, this is very text heavy and dense. So what I'm not going to do right now is try to talk through all of this. I'm going to give people a couple of minutes to sort of sit with this and reflect on what's there. If you're in the room or online with us today and you want to unpack a particular dimension and particular indicators and explore that and have a discussion about that, we're more than welcome to do that. And, you know, I think it's beyond the scope of this kind of introduction session that we would like to provide you to sort of name all of these. But I think these give you a sense of what we would try to measure under those 5 dimensions. So I'll just be quiet for a sec and let you take that in.
The missing headings for columns 3 and 4.
Third one is economic well-being, and the 4th one is health. Okay.
That's correct. And Phil, if you want to go on to the next slide, that's not the end of it. So there's the longest set of indicators are in the health domain. And so we have 13 indicators there. And these are the final sets of indicators across the other 5 domains. So I think that gives you a flavor. And again, if anyone wants to dive into these, we're happy to do so. What might be useful today was to take a bit of a deep dive into the personal security and violence indicators, thinking about the theme of the conference and what people might have top of mind. These are all priority areas. They're all things that are very important to all of us, I'm sure. But I thought it might be useful, if we go to the next slide, is to take some time to look at the personal security and violence indicators. And there's going to be two slides here, this one and the next one, and really start to look at what do we know already about the kinds of data we might have access to. So there's 2 things I want to say at the outset there. The 4th indicator here, which is in the concerns about physical, psychological, and sexual violence, there's a very strong link between that indicator and a major focus of SDG 16.1, which is concerned with the experience of violence of the general population. So there is a higher priority link there in terms of getting better LGBTI data into efforts to collect what the UN is already collecting. I think one of the things that's interesting about the index is that while it was introduced on the back of the SDGs being launched in 2015, the first consultation meeting for the index took place the week before the General Assembly met to agree Agenda 2030. So the synergies with the SDGs were at front of mind, but because our data needs in our communities are in many ways different and higher priority for us than it is for other people trying to do programming for the general population. There's been a lot of efforts to collect data here that don't relate directly to the SDGs. So I think that's a challenge and an opportunity for all of us who want to collect more and better data on LGBTI inclusion. And the other thing I wanted to say here is that the data across these indicators is mostly relevant across LGBTI people. The first indicator is of relevance to intersex people specifically. And the second is more relevant to lesbian, gay, bi, and trans people, although I'm sure people could argue beyond that. And then the third column here that says feasibility, I have either number 2 or 3 there. And if I had 1, we would say states are already collecting this data, specifically disaggregated for lesbian, gay, bi, trans, and intersex people. So it would be highly feasible to produce data sets across countries. But what you'll see here is that they're either feasibility tier 2 or 3. And feasibility tier 2 is that we had some sense after the indicators had been set that data could be found in various countries. Certainly not universally, but there would be sources of data that could be gone to. Whereas feasibility tier 3 were, there would be efforts to collect that data, which would require completely new data collection efforts, agreeing a new methodology to collect that data, and getting a whole new set of studies underway. So I think you can see across all of these concerns that there needs to be a massive new research agenda to collect this data. So again, if anyone has specific questions about these indicators, we can have a discussion about that. I'll ask Phil to go to the next slide here so that you can see the last set of indicators under personal safety and violence. And I think throughout these, I think it's important to note that some of the data that we currently think we have available would be coming out of data that's collected by civil society organizations rather than by police forces or other agents of the state. I would say importantly that there are efforts underway in countries that have a fully operational national human rights institution who are increasingly trying to gather the available data in their states to make important, to basically collect their findings and to monitor progress. And you'll see some of that data is often reported at UN level within the Human Rights Council. Okay, so again, very text heavy, so my apologies for those 2 slides, and happy to discuss further in, when we go to Q&A. Okay, Phil, next slide. Thanks. Okay, so I just want to close this sort of introductory part of our talk to reflect on what we what we found when we undertook our research, again, in our journal article, we go through that whole process of our methods and all that we were involved in doing to produce that article, which is really the first peer-reviewed publication about the Inclusion Index. What we found at the time, based on the stakeholders that we were interviewing and all of our background research, we found that there's not widespread utilization of or awareness of the index amongst UN member states, which is a worry because a lot of effort went into developing the index concept and setting the indicators, and yet very little has been done with it to date. We also found, very worryingly, that there was not consistent knowledge about the index amongst UN agencies and even some UNDP country offices. So there's definitely something that seemed to be high priority when we were all taking our time and energy to engage in this process that hasn't translated even within the lead agency. But we had one tangible output that I thought we all thought was really important. We had the opportunity to interview the independent expert on sexual orientation and gender identity, and he said that the existence of the index was extremely useful to him to have agreed UN language on a variety of issues that he would be writing about. So thus, he has actually utilized the index concept and the indicators to frame some of his thematic reports. So it's not as if the entire effort has been completely forgotten about, and it's been useful in UN-led process. There have also been efforts to pilot the index in a few countries, and it's really important to underscore that those have not been led by UN member states. They've been led by LGBT civil society organizations. One piloting of the index has been completed in Guyana, and several other are underway in the Dominican Republic, in Vietnam, Pakistan, Georgia, and New Zealand. And we really look forward to analyzing the results of these various pilot efforts. So just to underscore here, and why this is important to share in a conference such as this, is that it's civil society, not states, that are leading this charge. And we think this shows a great adaptability of the index. So with that, I'm turning over to Phil now, who's actually going to talk about a data collection process and study he was the principal investigator for in the Caribbean, and how that relates to utilization of the Inclusion Index. So over to you, Phil.
Yeah, thanks, Felicity. So really picking up on the idea that this index is adaptable and civil society is starting to use it. That's quite powerful. And again, we really want to share in that. How do we all use that as researchers, civil society, as other stakeholders that want to make more evidence for LGBTI advocacy? So our paper had two case studies. As Felicity said, I was a PI on the one that focused on 12 countries in the English-speaking Caribbean. It was for the organization called Open for Business. This was 2020 through 2021, the data collection itself and first presentation of data. First and foremost, they said, what is the macroeconomic cost of LGBTQ plus exclusion, right? Here I will say that I'm switching to Q plus because that was the focus of mine. Intersex issues were not specifically focused on, but LGBTQ plus, what is that macroeconomic impact in these 12 Caribbean countries, right? And of course, this is a region with a lot of challenges. A lot of colonial era laws against same-sex intimacy and love are still on the books, although they're going away quickly. There is a lot of social stigma. The church is quite powerful. There's a lot of challenges when it comes to the queer and trans people in this part of the world, as there is in many parts of the world. So yes, there absolutely is a way to come up with the economic cost, the macroeconomic cost of LGBTQ plus exclusion. And of course, the World Bank has already created the macroeconomic model to do so in 2015. It was created by Dr. Lee Badgett. I know it well. It was one of my first contracts with the World Bank. And it was really one of the first ways that we could take that macroeconomic model and work backwards to collect data on that. Say what is needed for us to come up with really rigorous, in-depth data to plug into this model to say, here's the possible solution. So in those 12 countries, there was a tremendous amount of data gaps. And what we identified through participatory research was some of the most pressing as it related to the needs of that macroeconomic model, right? And that comes down to challenges in family, in education, health, including COVID challenges, housing, employment, and labor market discrimination. Labor market discrimination is a huge and important one. Financial services, migration and brain drain, violence, justice, and tourism. So those are the themes that we really had to look at. That's a lot of themes, right? And for any researcher, it can be daunting. Like, how do we collect data against all of these themes, right? But fortunately, again, as Lucy already went through, there is this UNDP Inclusion Index, which has those 51 indicators, which are very powerful for researchers to say, I'm going to use these, right? And that's exactly what I did. With the folks in the participatory research, we decided to use 9 indicators based on the three themes of economic well-being, health, personal safety, and violence. So again, it was mixed methods. The quantitative side, there are 2 surveys. The first survey focused on LGBTQ plus people in the Caribbean, as well as within the LGBTQ plus Caribbean diaspora, predominantly in the US, UK, and Canada. So it's really important there to get the diaspora because not a lot of research compares between folks in host country and destination, home countries and destination countries. That really allows us to look at some of the drivers of migration as well as capture the brain drain. So that's why we included the diaspora component in that. That was the first survey. Second was to focus on tourism, and was interviewed close to 1,500 tourists, prospective tourists to the region, predominantly UK, US, and Canada. I forgot to say the first one was 2,167 respondents. And then the qualitative portion was in-depth interviews with businesses. Here we really wanted to capture occupational segregation. We wanted to capture labor market discrimination. It's all things that are very important to LGBTQ plus people at a micro level, but is also something we can aggregate and come up to the overall cost on the impact of homophobia and transphobia. So I'm just going to cover a little bit more of what we did in the data collection itself. We really hope that this gives kind of some context on the adaptability of this index and what we can do with it, right? When it comes to data collection, the analysis of data, and follow-up work. So again, as the original organization opened this says, what is the macroeconomic cost? We came up with that, again, using really in-depth data collection and many levels of rigor. And we said that as little as 2.1% of regional GDP is lost, right? So to put that into US dollars, that's around $1.5 billion. That's on the low end estimate. I just like to be cautious in these low end estimates, but it could be much more than that. And again, it comes down to challenges associated with less human capital, health disparities, labor output, again, due to labor market discrimination, which is such a challenge, violence, and tourism. So as I already mentioned, this, again, I don't know, if I were in your shoes and I saw, hey, 2.1% GDP is lost due to LGBTQ plus exclusion, I would probably be a little skeptical. But again, there were many levels of rigor involved in how we did this. Utilizing the World Bank model, I worked directly with Dr. Lee Badgett on this, and we had a number of ways to ensure that this is really coming up with the best estimates that we have out there. So that when we worked on this in dissemination, so that when we worked with governments, we can say with assurance, with confidence that here is something that is actually lost due to the economy, due to these significant challenges at the micro level. Yeah, so I don't want this to be all about macroeconomic costing because really the strength is in that microdata. That what is it that people experience? What are the challenges? What are the outcomes? So I really wanted to go through this a little bit and showcase some of the patterns that emerge from the data itself. And suffice to say, it's quite challenging, right? So from our sample, LGBTQ plus people are 3 times more likely than the non-LGBTQ sample to live with anxiety, right? I will say, you see that there's a non-LGBTQ plus sample involved because what we found was that it was such a large data set that actually straight gender is part of this too, and that allows us comparison, which is really interesting. In addition to comparing it to other data that has been gathered by international organizations. So we do actually see that they're 3 times more likely to live with anxiety. That's a significant mental health challenge. Again, I've already mentioned labor market discrimination, but for the LGBT sample, close to 1 in 5 experience discrimination or exclusion during the hiring process. To the non-LGBTQ plus sample, only 11%, right? The impacts are severe. For the queer and trans sample, they didn't get the job. There was no promotion. They were fired. They were deprived of opportunities for the partner to access benefits. These are all significant challenges associated with labor market discrimination, and why actually we found that LGBTQ plus people earned 11% less than the general population. That was actually a finding from our data utilizing official data from Belize. That comparison is quite powerful, and do not want LGBTQ plus people earning such less. We want there to be an equal wage, of course, but we really need to work on those structural factors that lead to this. Violence is prevalent. 46% of LGB and 59% of the trans sample experience physical or verbal violence in the community. Only 5% of the non-LGBTQ sample experience that. And of course, access to justice is small. Only 14% of the LGB and only 17% of the trans sample reported the violence. There's not a lot of trust in institutions. This is text heavy. I'll walk you through it real quick because it just shows you the challenges that LGBTQ people experience, particularly versus straight and cisgender sample. If you look at the top part, top line, I've experienced discrimination or exclusion from my family. That's around 1 in 2 of the LGBT sample experience those actual challenges in the family, and because of their sexual orientation or gender identity. For the straight or cis sample, it's significantly less. If you jump to here and down, you see that the impact is quite significant. It's detrimental. There's that feeling of shame or struggle with mental illness, denied the ability to live openly as LGBTQ, deprived of financial resources, which is of course socioeconomic impacts later in life, kicked out of the house, or forced into so-called conversion therapy. All significant impacts. So more from the Caribbean data itself. This is more recent analysis. We're doing follow-up research just to look for other patterns, more regressions, more detailed correlations, causation variables regionally, but we're also focusing on Belize. There's a lot of interest there with the government to work on these findings. And what we see is a clear statistically significant link between lower socioeconomic status and a greater likelihood to experience psychological and physical violence throughout one's life. So the poorer you are, the more likely you are to experience violence driven by homophobia or transphobia. This actually comes right out of gender-based violence literature and gender equality field. It's something that many advocates and researchers have found there. It's very important because it's one of the few times that we found this in the LGBT data. And of course, the higher socioeconomic status is related to more likelihood to report it. This next one is for those experiencing exclusion from the family. Again, a statistically significant impact on likelihood to have less mental health when confronted by challenges in school and community. So we know that the family is exceptionally important to mental health and socioeconomic status later on. And here's just one of those empirical findings, the extra challenges for those who experience violence or exclusion from the family. All right, so apologies, I think I spoke about this in the last session, but what we're really trying to do with this data is activate it. It's not okay that there's just research after research that sits on shelves, it sits on websites. We really need to work with it. We need to work with the community to activate it so that something can emerge from it, so that policy-driven outcomes can emerge from very extensive data sets. And that's exactly what we did within the Caribbean. So a number of groups and I came together and we said, we want to present all of the research that is out there. In the Caribbean right now, there's a tremendous amount of LGBTQ+ research. So we fundraised and we brought together 150 stakeholders to an actual space in Barbados. And those stakeholders were civil society, courts, regional courts. It was all of the multilateral development banks, International Monetary Fund, it was governments, members of economists and academics. And we said, here's all this treasure trove of data. How do we look at this through different themes of labor market challenges, of education, healthcare? What do we do with this great policy interventions? So after that, we have this entire buffet list of policy options that emerged. We're now trying to pilot it, those options at the country level. What is happening in Belize is that there's significant interest from the government with their state statistical office to do large scale data collection and turn that into action plans. So yeah, again, just to sum up my section, and I'll turn it over to you, Felicity. There's a lot that can happen with data. And I think what we found is that this index that we're returning back to, it's adaptable. And all these indicators are there. They're globally agreed upon. They're created by stakeholders, by the community, for the community. It's quite powerful. And again, it's something that we really want to discuss in the Q&A, or just how do we better activate this elsewhere? So I guess, Felicity, do you want to take on the conclusions, or?
Yeah, sure. We can look across the conclusions. If again, accessing the article, we have another case study there of a survey which we weren't able to conduct. I was on the research team for that survey across 5 sub-Saharan African cities. And I think it was important for Phil and I to compare the process of including those indicators in the 2 survey development processes, and finding that only 5 common indicators were utilized from the domains of health, economic well-being, and personal security and violence. So you'll see that that means that there's not extensive ways to compare across LGBTI experiences in various countries or even regions. And again, that underscores our concerns about the paucity of data sets on LGBTI people, which, Phil just spoke to, his really important efforts to activate this groundbreaking data collection that he and his partners were able to do in the Caribbean. Because so that things don't sit on shelves, but there's very, very little on our shelves to begin with. So I think what happens often in advocacy is that we see that we rely on sort of exemplar studies. So we rely on concepts like, minority stress, and we try to extrapolate the original empirical work that was done to determine minority stress in one setting and export that to other settings. And that I'm not questioning the sort of strategy of advocates to do that. But I think what we need, and you can see from the results that the Open for Business and Virgin Atlantic Virgin Foundation Fund in Caribbean was able to do with that kind of concerted effort, you have this really, really good granular data. And you also have comparisons between LGB and trans and the general population. So we really need to be creating a research agenda that gets beyond utilizing exemplar studies in our advocacy. So again, we know that this index, I think, our key message is that we believe the index is adaptable, and we can show it's being utilized by civil society organizations. And there's a strength there in having a common and agreed upon set of indicators to inform data collection. And, overall, we're stressing that even though civil society is leading on this, we feel very strongly that UN member states and the UN system should be scaling up, starting with more sensitization of the index and piloting. We've got a couple further concluding slides here. Fill the next slide there. Yeah. So, this lack of rigorous quantitative data about LGBTI people in developing countries is thwarting efforts to develop policy and programs to enhance inclusion. And we feel very strongly decision-making to implement rights and inclusion needs in all of its society engagement, which requires gathering data on populations which have historically been left out of social policy and law reform and left behind in economic, social, and human development. So we think the index is a tool that may be useful to a variety of practitioners, human rights, development, local community practitioners seeking to generate new data or use secondary data, which we haven't talked about a lot today because we've been very focused on empirical data, to measure whether socioeconomic inclusion interventions are accessible to LGBTI people. And just a final concluding note, next slide. So again, I want to reiterate, going back to searching for a set of proposed indicators by Lee Badgett and Randy Sell to understand the index theoretically. They could be regarded as a toolbox, so that could help guide questions to ask to highlight the issues faced by LGBTI people, been left behind in economic development and human rights implementation. They could be used to focus on filling gaps, and again, reflecting back on those the data that's currently considered that it's not as feasible. So feasibility tier 2 and 3 data. And they could be utilized as a novel research agenda to frame data collection undertaken by a range of stakeholders, researchers, human rights and development professionals, and very importantly, LGBTI civil society actors, not only states. And they could be used in many ways to augment and perhaps even challenge state data where state data is available. So we wanted to conclude with a couple of key questions or points potentially for discussion, but again, that's over to you, what you want to bring up. We could discuss how do we raise awareness of the index? What can we learn from the efforts to pilot it? How can we expand our networks and our partnerships for data collection outside of the high and middle income countries that have started more and more in national statistics offices and national surveys? We need this data in low and middle income countries, those middle income countries that haven't contributed thus far. And I'd like us to think about, what capacities, whether you're a researcher or you're an activist, what are the capacities that you think need to be built to undertake new data collection? What do organizations and individuals need in order to get involved in this data revolution that we're suggesting we need? So with that, over to you. Thanks very much.
Really interesting, fascinating, because the new systems of measurement are always interesting. I think first question I want to ask is, you've mentioned that sort of the openness to adopting this inclusion index has been taken on by societal organizations, but not at nation state levels, and even like government bodies and so on. Do you have sort of an idea of why that is? Have you had feedback about that in any way, shape, or form? I mean, history tells us that it's very hard to get governments to change their ways, especially when it's telling them how to measure stuff. I'm just wondering if you've got a bit to say about what you found out so far, about whether it's been pushed back or been ignored.
Yeah. Felicity, do you want to take that one? I could jump in.
Yeah. Thanks. Sorry, I can't see you, so I don't know who asked that question. But that's an important point. And yeah, it's sort of in our findings, we definitely have seen that there's just not been a sort of knowledge translation effort undertaken on behalf of UNDP, potentially other sort of stakeholders from the High Commission on Human Rights or from the World Bank to use the momentum, translate the momentum from developing this tool and negotiating with member states. It's what's frustrating is that it's not as politically sensitive as it might have been in the past, particularly if you think about the member states who are engaged in the Equal Rights Coalition, which there may have been a discussion across the conference the last day around the ERC, especially given what happened last year. So there might be an awareness that there are a number of member states that should be doing this work if they're engaged in high-level diplomacy. They should be backing up that diplomacy with their own data about how well they're doing in terms of LGBTI inclusion in their own country and their concerns about supporting that abroad. Some states are very good on that. I'm going to think of Sweden in particular. That's been a major development funder that's been LGBTI inclusive for the better part of the last 15 years. So there's just some kind of knowledge translation problem going on here. It's not as much of a political sensitivity for certain member states, but we know there's vast amount of states where this would be a very difficult negotiation. And you might need to focus on a couple of priority indicators. And I think based on what Phil's just presented, some of those might come down to questions of the experience of violence, the experience of homelessness, the experience of poor mental health. And, you could still be thinking about how states might be reflecting on the mantra of leaving no one behind and what that really means, that there are not particular communities that can just be excluded from the human and social development sphere. Phil, I'm sure you have other comments to add there.
Yeah, Lucy and I and a few others have been trying to work with statistical offices on this particular dimension of large-scale SOGIESC data collection. I think what I found is that they're really risk averse. They're very cautious. Minnesota's statistical offices. It really takes an internal champion there mixed with political will of the government. So that alignment can be very hard. So it's doable, and we're working on it. I think in particular UN agencies, the development banks that we we're talking about in the last session, that on this agenda are kind of banking, like they're ready to let civil society burden a lot of this work. They're kind of just ready to allow them to be on it. I think that's what we need to be pushing back against as civil society organizations, really finding where to say to do so and possibly do so, and expecting more governments and UNDP to really pick this up.
Yeah, sorry I couldn't be with you all today. It's very complicated sometimes getting from the west of Ireland to the northeast of England. So, and then I've got a lot of other things going on at the moment, but I'm so glad I was able to join you. I hope everybody's having a really great conference, and I hope we've contributed something to our conversation about how to expand our capacity for evidence-based advocacy. So thanks so much.